Most people who reach kidney failure never saw it coming. No burning when they peed. No dramatic changes in urine. Just subtle clues that were easy to ignore until dialysis became the only option. Today, I'm going to show you the 9 warning signs your kidneys may be failing, the exact tests that catch trouble early, and the steps that can help you avoid dialysis for as long as possible. Set up and why this matters right now. Tens of thousands of people are living with end-stage kidney disease, also called kidney failure. When kidneys reach that stage, you need either a transplant or dialysis to survive. There's no way around it. But here's the hopeful part. Kidney failure usually happens after years of slow decline. If you learn the signs and act early, you can change your trajectory. One more thing before we dive in. What you're about to hear is educational, not a personal medical plan. Your body is unique. Use this video to get smarter questions. Then talk with your clinician about the right next steps for you. What? Kidney failure actually means your kidneys are the body's filters. They clear extra fluid, balance minerals, control blood pressure hormones, and keep your blood clean of waste. In the final stage of chronic kidney disease, stage 5, those filters are badly damaged. Waste builds up in your blood, electrolytes drift out of range, and fluid can collect where it shouldn't. Symptoms don't always start with the bathroom. They often start with your energy, your skin, your breath, even your memory. Let's walk through the 9 red flags. Warning sign number 1. Relentless fatty you not. Just I stayed up too late tired. This is a deep, bone-heavy fatigue. As toxins accumulate, your brain and muscles run on dirty fuel. On top of that, damaged kidneys make less erythropoietin, a hormone that tells your body to produce red blood cells. Fewer red blood cells equals anemia equals less oxygen delivered to your tissues. It's a triple hit that makes stairs and grocery bags feel like marathons. If your energy has nosedived without a clear reason, especially alongside diabetes or high blood pressure, don't just push through, get checked. Warning sign number 2. Muscle cramps and twitchy seor in bed. Almost asleep, and then bam, calf cramp that launches you upright. While cramps have many causes, kidney failure skews electrolytes like calcium, magnesium, and potassium. If you're already on dialysis, rapid shifts during a session can trigger those Charlie horses. Persistent, unexplained cramps, especially with other signs on this list, deserve a closer look. Warning sign number 3. Swelling you can see and dent look at your ankles, shins, or fingers. Do socks carve a deep line? If you press the shin and it leaves a pit that lingers, that's pitting edema. Failing kidneys struggle to dump excess salt and water, so fluid backs up in tissues, ankles, feet, hands, even around the eyes in the morning. Swelling has lots of causes, but combined with fatigue or shortness of breath, it's a big clue that your fluid balance is off. Warning sign number 4. Loss of appetite. Nausea, early fullness, uremia, waste chemicals in the blood can switch off appetite. Change your taste for foods and bring waves of nausea. People with diabetes may also develop delayed stomach emptying, so they feel full after just a few bites and then nauseated. If you're unintentionally losing weight, skipping meals because nothing sounds good, or dealing with persistent queasiness, don't chalk it up to stress or a bug. Pair that symptom with the others in this video and get labs. Warning sign number 5. ITCH that drives. UMADH in kidney failure, uremic pruritus can be relentless back. Arms, scalp, often worse at night and made worse by dry skin or heat. Scratching can break skin and invite infections. Moisturizers help the dryness, but if the itch is intense and constant, that's your body's way of saying something systemic is off. Warning. Number 6. Shortness of breath. Walking across the room shouldn't make you winded. In advanced kidney disease, fluid can accumulate in the lungs, pulmonary edema. Anemia reduces oxygen delivery, and inflamed, weakened respiratory muscles can't keep pace. If you're finding it harder to breathe, especially when lying flat, you wake up gasping, seek care urgently. Warning sign number 7. Brain fog. Memory slips, confusion, humic toxins don't just bother your skin, they irritate your brain. People describe it as cotton in my head. Trouble focusing, forgetting conversations, feeling confused. Anemia and poor sleep make it worse. If your thinking has changed and you're noticing other signs from this list, it's time for a workup. Warning sign number 8. Urine-like breath. Metallic THST. There's a telltale breath odor in advanced uremia, sometimes called urine-like or ammonia-like. Food tastes metallic or off. Chewing mint after mint doesn't fix it, and your mouth may be unusually dry or sore. That's not just a dental problem. It's a systemic signal. Warning sign number 9. Pale skin from anemia. A yellowish or gray tinge from retained pigments or darkening in certain areas can all show up. Extremely dry, cracked skin xerosis is common, and scratching from itch can leave marks that don't heal quickly. Sunscreen, gentle cleansers, and thick moisturizers help, but again, treat the cause, not just the symptom. Real talk TNF. 3 or more of those sounded uncomfortably familiar. Please don't wait for a dramatic symptom to confirm it. Kidney failure rarely announces itself with pain. It whispers. The good news? A few simple tests can translate those whispers into clear answers. The tests that catch problems. Ask your clinician about these. If you have diabetes, high blood pressure, heart disease, a family history of kidney problems, or you're over 60, make this your annual checklist. Blood creatinine gives eGFR. A blood draw estimates how well your kidneys filter. An eGFR persistently below 60 suggests chronic kidney disease. Below 15 is kidney failure. Blood, urea nitrogen bun, another waste marker. Elevated levels support the picture of reduced clearance. Urine, albumin, creatinine ratio, ORC or protein creatinine ratio, detects protein curly damage to the kidney filter vent when eGFR is still normal. Electrolytes and acid base, potassium, sodium, bicarbonate. These guide safe treatment. Complete blood count CBC. Checks for anemia, mineral bone labs, calcium, phosphorus, vitamin D. Parathyroid hormone. Kidneys regulate these. Renal ultrasound, non-invasive imaging to look for small, scarred kidneys, cysts, stones, or blocked outflow. Sometimes specialized imaging or a kidney biopsy, if the cause is unclear, or to guide therapy. 2 important notes. First, some meds and supplements can nudge these numbers in the wrong direction. Ever stop anything abruptly. But do bring your full med supplement list to your appointment. Second, a single abnormal result isn't a life sentence. Your clinician will repeat tests and look for trends. What you can do to avoid OR delay dialysis treatment is not dialysis or nothing. There's a lot between here and there. The earlier you start, the more runway you have. Medication foundations. If your blood pressure is high, these like ACE inhibitors or ARBs, and often SGLT2 inhibitors if you have diabetes, can slow kidney scarring. Diuretics help with swelling. If you're anemic, your team may use iron and, when appropriate, erythropoiesis-stimulating agents. If acid levels are low, bicarbonate can help. If phosphorus runs high, binders may be added. This is all personalized. Don't copy a friend's list. Lifestyle that actually moves the needle. Sodium smart. Most people benefit from cutting sodium to approximately 2.3 grams a day, unless told otherwise. Read labels. Restaurant meals are salt bombs. Protein, not zero, not max. Your clinician or renal dietitian will set a target often around 0.6 to 0.8 grams per kilogram day in non-dialysis CKD, unless malnourished. Too much protein can accelerate waste buildup. Too little risks muscle loss. potassium, and phosphorus. These are individualized. If your labs are high, your dietitian will help swap foods, not just restrict everything. Hydration. Drink to thirst unless your team has given you a fluid limit. Extreme chugging isn't protective. Steady, sensible intake is. Move most days. Even 20 to 30 minutes of walking helps blood pressure, energy, mood, and muscle. Sleep and stress. Better sleep improves blood pressure and inflammation. Short nightly routines matter. No smoking. Tobacco speeds kidney decline and damages blood vessels. Quitting is one of the biggest protective moves you can make. Medication hygiene. Avoid routine NSAIDs like ibuprofen, naproxen, unless your clinician okays it. They can reduce kidney blood flow. Be cautious with megadose supplements. Always ask before starting new over-the-counter products. If your kidneys reach the finish line, dialysis keeps people alive. And many live full lives on it. Hemodialysis is usually 3 days a week in center. Peritoneal dialysis is done at home, often nightly, and offers flexibility. But the gold standard for many is kidney transplant, which generally offers the best long-term quality of life, though it requires a match and lifelong anti-rejection meds. If you're anywhere near stage 4 CKD, talk now about transplant evaluation and dialysis education classes. Preparing early reduces fear and improves outcomes. Red flag symptoms. Don't wait. Seek urgent care if you have chest pain, severe shortness of breath, fainting, almost no urine output for a day or two, palpitations, severe weakness, or new confusion, persistent vomiting with inability to keep fluids down. These can signal dangerous electrolyte shifts, fluid overload, or severe uremia. Your 7-day action plan, Day 1. Write down your symptoms from this video. Circle the ones you feel most weeks. Day 2. Gather your meds and supplements, everything, and make a simple list. Day 3. Book labs with your clinician. Creatinine, EGFR, ACR, electrolytes. CBC. Day 4. Start a sodium audit, read labels. Swap one high-salt item for a low-salt alternative. Day 5. Add a 20-minute walk or equivalent movement. Day 6. Pick one hydration habit. Keep a reusable bottle and sip steadily. Avoid huge chugs. Day 7. Schedule time with a renal dietitian if your lab suggests CKD. They're game changers. Small steps compound. You don't have to be perfect. You just have to start. Conclusion: kidney failure rarely arrives like a lightning strike. It's more like a slow, dimmer switch. If today's video turned the lights on for you even a little, act on it. Get your labs. Ask better questions. Build kidney-smart habits. And if you're already on dialysis or listed for transplant, your vigilance, your consistency, and your support system are powerful medicine. Thanks for watching. If this helps, share it with someone who needs a nudge to get checked. Your share could literally change a life.